Hi, this is Dr. Epstein. I'm here to discuss my approach towards eyebrow restoration or eyebrow transplants. This is based on the performing of over 700 of these eyebrow procedures. The majority of patients are women, but probably 35% of my patients who've undergone eyebrow transplants are actually men. The concept behind eyebrow transplants is we're taking hair, most commonly from the scalp because those hairs are the most reliable in how they grow, and then we're placing them into the eyebrow, or eyebrows most commonly, into an aesthetic pattern so they look natural. Most commonly, that pattern involves having the inner hairs grow pretty much straight up while the hairs along the top edge grow in a slightly lateral and downward angle. Meanwhile, the hairs in the lower hairs grow in a slightly upward and lateral angle. So then we get a crosshatch pattern that continues out to the distal tail, which is then used primarily hairs that are growing horizontally. The majority of hairs that I use for eyebrow transplants consist mostly of 2 hairs. Sometimes I'll even use 3 hairs in a single graft. And the reason for this is the average eyebrow has at least 2,000 or at least 1,500 to 2,000 hairs. So if I'm doing an eyebrow transplant of, say, 400 grafts per side, if I do an average of 2 hairs, that's around 800 hairs, which is going to provide a pretty nice look. Maybe not as full a look as a Katy Perry or some other, patients or individuals rather with prominent eyebrows, but it will provide a nice amount of density. But most importantly, my approach to eyebrow transplants is to make sure that the results look natural. How do I do that? Well, first of all, I transplant the hairs, making the recipient sites as flat as possible so they don't stick out, so they grow flat. Secondly, I obtain the hairs most commonly by the FUE or follicular unit excision technique, taking each hair out one at a time, which does not leave any scars, usually, or any linear scars, usually allows patients to shave their hair very short. As far as how the procedure takes, it requires around 4 to 5 hours. Recovery for most patients at 5 or 6 days, they look great. In fact, the hairs will be present. Around a week or 2 later, the hairs will fall out. Then the eyebrows will look just like they did before the procedure. And then starting at around 3 to 4 months, the eyebrow hairs will start to regrow again and continue to grow for a lifetime. Because they're scalp hairs, they need to be trimmed. In order to get the closest match of hairs, I'll pick out specific hairs, sometimes using hairs lower down in the neck that will be finer. Sometimes I want slightly thicker hairs, so they'll go slightly higher up in the back of the head. But using these approaches, I've been able to, as I said, restore the eyebrows on hundreds and hundreds of patients and have been able to achieve consistently refined results, and therefore, just able to have a lot of happy patients who have undergone this procedure. Thank you.